Here's something I wish I learned in grad school. I'm Amy Graham, a speech language pathologist in Colorado, and I specialize in speech sound disorders. When we are studying specifically my area, which is speech sound disorders, all those interventions that are highly evidence-based, the way that they're studied is not often practical for what SLPs are going to be doing in the real world. For example, a lot of these interventions are studied with one-on-one speech therapy, which if you're in the schools, that's probably not happening very often. And these kids are often seen twice a week, 3 times, 4 times a week, depending on the intervention that's being studied. In the real world, we don't often have the service delivery model to support that. We have to work within the guidelines of our employers. So it's important to use some critical thinking and our clinical reasoning to determine what aspect of that evidence-based intervention is the most important thing to incorporate and adapt to our service delivery model. When it comes to speech sound disorders, the most important thing is probably your target selection. Choosing the right thing to target depending on what subtype of speech sound disorder the child presents with. And then once you've chosen appropriate targets, high accurate trials. Those 2 things will make all the difference, even if your particular place of work doesn't necessarily conducive to the type of approach that you want to use for that child. What about you? What are some things you wish you learned in grad school? Comment below.